Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul uqdatam min lisani yafqahu qawli. Allahumma inni as'aluka ilman nafi'an rizqan tayyiban amalan mutaqabbala shifa min kulli da. Today the topic of discussion is contraception, and I will discuss this topic in two parts, part 1 and part 2. Today I will discuss part 1 of the contraception. Contraception, that is birth control, prevents the pregnancy by interfering with the normal process of ovulation, fertilization and implantation. Birth spacing. It is interval between sexual relations by a woman and the birth of her first child and intervals between successive births. It includes use of family planning to control birth intervals. Family planning allows individuals and couples to anticipate and attain, their desired numbers of children and the spacing and timings of their birth. Contraception. There are many types of contraception widely used nowadays for family planning purposes. Each method has its advantages and suits special cases and not necessarily suits others, and the choice of contraception depends on different needs of the patients, like the period of contraception, and also doctors should decide which method suits needs more. No method of contraception it is completely effective, and failure rate for most reversible methods, they are strongly influenced by compliance. Types: fertility awareness method, barrier methods, hormonal contraception, IUCD, that is intrauterine contraceptive device, it is long-acting reversible contraception, sterilization. Characteristics of the ideal contraception: it should be safe, 100% effective, free of side effects, easily obtainable, affordable, acceptable to the user and sexual partner, free of effects on future pregnancies. Fertility awareness methods, also known as natural family planning methods. These methods include finding when a woman is at her most fertile so that she can be extra careful or avoid sex altogether during these times. This can be done by using techniques such as the woman keeping a daily record of her body temperature using a special fertility thermometer. A combination of techniques is recommended to increase the effectiveness of these methods. There are a natural alternative to the hormonal and barrier methods, but the techniques used require a significant level of motivation and a clear understanding of how to monitor fertility. Natural family planning methods, they include: number 1 is the cyclic method, basal body temperature BBT, cervical mucus method, ovulation awareness method, lactational amenorrhea method, and withdrawal, that is coitus interruptus. Cycle or rhythm methods. This method can be used for patients with regular cycles only. This is done depending on the exact knowledge of the ovulation day and avoiding intercourse during the days before and after ovulation. For example, in a regular period that occurs every 28 days, the exact day of ovulation should be the day 14, so the intercourse should be avoided 4 to 5 days before and after this period. First fertile day, that is shortest cycle, that is 20 days, and last fertile day, which is the longest cycle, that will be the 10 days. Temperature method. Increase in body temperature by about 0.2 to 0.4 degrees centigrade due to raised progesterone following ovulation. Affected by illness, infection and medication, failure rate is 2 per 100 women years. Change in type cervical mucus. It becomes clear, slippery and stretchy. Stretchy, that is spin-barked phenomena. Abstinence should be maintained from the day when the fertile mucus appears until 3 days after the peak days. Failure rate is 20 to 100 women years. Personal fertility monitor. Ovulation kits nowadays, they are available for ovulation day detection by measuring LH surge. Failure rate is 600 women years. Coitus interruptus. This is usually mostly practiced in the couples. When having intercourse, the man has to withdraw out of the vagina before ejaculation. Just before the ejaculation, he has to withdraw, otherwise there is risk of semen can enter inside the vagina. This is intended to stop the sperm from entering the vagina. This method frequently fails as drops of sperm can already escape from the penis into the vagina before the man ejaculates. So effectiveness failure rate can be as high as 15%, 15 pregnancies per woman, and more reliable methods are advised. Barrier methods. It includes the male condoms, female condoms, diaphragms, spermicidal, intrauterine device, IUCD, it should be intrauterine contraceptive device, sponge. Male condom. It is a thin latex or plastic sheet used during sex to trap sperm at the point of ejaculation. It is put on as soon as organ is erect. Before any contact takes place with the vagina, men should withdraw as soon as they have ejaculated and take care not to spill any semen. Condoms must be used with care as they can slip off or split. They should never be used with oil-based products such as petroleum jelly or suntan oil, or these will damage the rubber. Advantages. Easily available, offers protection against sexually transmitted infections including the HIV/AIDS. Effectiveness 94% to 98% depending on correct use. Female condoms, Femidon. It is a thin polyurethane sheet placed inside the vagina, also covering the cervix and the area outside. To stop the sperm from entering, it can be put in at any time before sex and is actually stronger than the male condom. Advantages. Offers protection against sexually transmitted infections including HIV and AIDS. Effectiveness 95% if used correctly. This is female condom picture. You can see here it's a sort of ring, and this is elongated sheet, and this is put inside the vagina. This height, it mimic the height is the length of the vagina. This length of this condom mimic the length of the vagina. Here you can see this is inserted in the vagina, and this is the uterus, and here one end is closed end and one is open end. This is female condom. This is inserted with the finger, and then here the closed end, it is put up, it is covering the cervical os. Diaphragm and cervical cap. A diaphragm or the cap is a dome of the rubber which is fitted by the woman over her cervix before intercourse. It acts as the barrier to stop the sperm getting through to the uterus. It should be used with the spermicidal cream jelly that contains a chemical that kills sperm. The diaphragm must stay in place for 6 hours after sex. Advantages. Only needs to be used when the couple has intercourse. Spermicides may cause irritation or an allergic reaction. Effectiveness, it is 92 to 96% if used correctly. You can see in this picture, and this again. Here you can see the cervical cap blocks the sperm from entering the cervix. Spermicide is applied here. This is sperm, and spermicide inside the diaphragm kills the sperm. This is fem cap, again cervical cap. Vaginal sponge. Vaginal contraceptive sponges, they are soft synthetic sponges saturated with a spermicide. Prior to intercourse, the sponge is moisturized, inserted into the vagina and placed over the cervix. After intercourse, the sponge is left in place for 6 to 8 hours. It is quite similar to the diaphragm as a barrier mechanism. About 18 to 28 pregnancies occur over 1 year for every 100 women using this method. The sponge may be more effective in the women who have not previously delivered a baby. In an early Paris woman. Spermicides. These are creams, gels, sponges, or species that contain a chemical that kills the sperm. They can increase the effectiveness of the certain barrier methods of the contraception such as diaphragm. However, they do not provide reliable contraception when used alone. IUD. IUD, also known as a coil, and it is a small plastic and copper device usually shaped like a T, which is fitted into the woman's uterus by a doctor using a simple procedure. It works by preventing an egg from settling in the womb. An IUD can stay in place for 5 years, sometimes for 10. It can also be used as an emergency method of contraception within 5 days of unprotected intercourse. Advantages: no need to think about it once it is in place, and it lasts for a long time. Considerations: there is a higher risk of infection for the women with more than one partner. It may cause heavier, more painful periods. Effectiveness is 98 to 99%. Now, types is non-hormonal and hormonal. In non-hormonal, copper T and multi-load, and hormonal containing, that is the Mirena. You can see this picture. This is the multi-load, this is copper T, and this is Mirena. Different shapes you can see. Hormonal family planning methods, and this is, inshallah, we will discuss in the second part of the contraception lecture. Thank you very much. I hope this part 1 of the contraception lecture will help you and increase your knowledge.